Bill, you've got a big idea. Over the next 15 years, the lives of people in poor countries will improve faster than at any other time in history. What makes you so confident about making a prediction like that?
There's a lot in the pipeline, whether it's medicines or the way people bank or get educated. And we're seeing that people care about these issues, and our ability to communicate and draw people in is better than ever before. And so that's our bet, is that this next 15 years will be fundamental for the basics. Kids surviving, people having a bank account. This will be a period of incredible improvement. For a country to do well, you've got to get the nutrition of its citizens, the health of its citizens, the education level of citizens, the financial empowerment up to a certain level. And so by having these tools, some of which are vaccines, some of which are mobile phone-based delivery, then the lives they lead, the economy, really will be self-sufficient.
What specifically has changed in the 15 years since you and Melinda started the foundation to create breakthrough opportunities in the next 15 years?
Well, the childhood death is one where there had been a lot of work done before we got involved during these 15 years, and that rolled out. And so since 1990, that's been cut in half. Now we have those vaccines, some of which are just starting to get out, some of which are still in the lab, that given the full 15 years, we'll be able to get those to all of the world's children. So scientific understanding keeps advancing, understanding HIV, malaria, all these different diseases, understanding nutrition, what kind of seeds are productive, what kind of diet do you have to have, how do you teach farmers to grow more than one crop a year and use variety to maximize their output, the amount they can sell for, and what they themselves are able to eat.
What's more important, would you say? Technological innovation, awareness and support for what you're doing, or the sheer amount of money that is being invested in the kinds of programs that you support?
All of those are pretty important. It's almost like you have to multiply them together. Without the science, we couldn't make the better seeds or the vaccines or have digital money. Without the donor generosity, actually getting these things out to those who need them the most, it just wouldn't happen. There's no market mechanism. The vaccines would be going to the kids who are at the least risk of getting sick, and not at all to those who have a very high risk of getting sick. But to have governments come up with that money, you need this broad awareness. You need them encouraging their governments that even though these people are far away and not often seen, and these deaths are kind of one at a time, it's not this one-day tragedy that does grab people. It's this ongoing set of diarrheal deaths or pneumonia deaths that if you have an awareness of that and see that it can be cut, then you'll volunteer time, you might give some money, but most importantly, you'll make sure your government takes some of its resources. Even 1% would be very generous, and gets that out to poor countries.
Bill, if you look back on the first 15 years of the Gates Foundation, what, in retrospect, would you say was the best decision that you made or the smartest thing that you did?
I think we've learned a lot in the 15 years, and so maybe that has been the most valuable thing. The biggest impact we've had so far has been in childhood health. We created in the year 2000 this group called Gavi, has saved over 10 million lives. And a lot of kids who would have been sick and not fully developed, even if they'd survived, the vaccines have made a big difference for them. So that one's the best, and everything else has to be measured by that kind of breakthrough success.
Indeed, it's hard to top saving 10 million lives. What was the biggest mistake?
Well, a lot of things required us to get in and try out pilot programs and see what would work. In education, the structure of high schools, trying to make it so they weren't quite so big. We saw some benefits there, but that alone wasn't enough. How you get teachers more feedback about what they're good at and how they improve, letting them be exposed to other teachers doing things better. That we've gone through many iterations. We have some pilot sites that have gone very, very well. But still today, the secret to how you raise the average teacher up to be as good as the top 10%, not yet solved, and yet so valuable, and some places where we have that result that we do want to figure out how to scale it up. So a lot of things take more time than I expect.
How about the most valuable lesson you learned?
Well, our early years, we thought we were so naive, we should just work on our own, invest in science, not try and team up and influence joint strategies. As we got further down the learning curve, particularly in health, then we saw that we needed to come together with the government aid budgets and the groups in the field. So how you develop those partnerships, whether it's with the UN groups like UNICEF and WHO, country groups like USAID, the nonprofit groups like MSF or CARE, Save the Children, building on our complementary strengths where we understand R&D better than these groups. They understand the field better than we do. How you make all that come together, that kind of partnership model has been a huge learning curve, and I do think we're far better at it now than ever.
What, in your opinion, is the best way to narrow the inequality gap? By raising taxes on the wealthy or funding programs to reduce poverty and bringing people up from the bottom?
Well, if you look at the world as a whole, it is less more equal now than in the past. And that's because poor countries like India or China have had growth rates, including wealth growth rates, way above that of the rich countries. Within individual countries, though, the inequality has gone up in almost every country. And there, I think everyone believes in a balance, that you should have progressive taxation, that as you get wealthier, your consumption, your income, your estate ought to be subject to much higher taxes than, say, the middle class. And I personally think the U.S. could be even more progressive in that. But the thing most people would emphasize that is critical is the equal opportunity, that if the inner city schools are really, really good and the access to health so that that's not holding people back, or social services, if that's strong enough so that we can say, every kid has a near equal chance of becoming a lawyer or doctor, going to a good school, that is even better, because that's about freedom and that's about developing capacity as opposed to a zero-sum transfer. Now, you have to be able to fund the things that create that opportunity, and taxes are absolutely necessary. So it's those two operating together, taxes to fund it, and then the execution, so you have that equal opportunity. We don't have equal opportunity. It's what we aspire to as a country, but education alone is so poor if you grow up in the inner city compared to the suburbs that we're not being true to our basic credo.
Much of the monetary policy we've seen since the financial crisis has been motivated by aims ostensibly as noble as yours, reviving the economy, creating jobs, keeping families in their homes, improving the financial situation for as many people as possible. Did it work?
Well, when you have the aftermath of the collapse of a credit bubble, ironically, part of what you're trying to do is get people not to be too conservative, and so you're encouraging them to spend. You even want mortgages to be cheap again. The world economy is coming back somewhat. The Eurozone still has a challenge because of their ability to manage very different economic results within the framework of a single currency and no common fiscal policy. But the U.S. is Exhibit A, that spending has gone up, the job market's gone up. It was slow, and a financial bust is much more likely, is going to be slower than a business cycle bust. And so people are starting to feel pretty good that if nothing else comes along, that we'll be on a upward growth path.
There are some people, lots of people in fact, who say that the cure is as bad as the disease, that quantitative easing in particular disproportionately benefited the wealthy and didn't really do that much for the poor, or for that matter, for the middle class. Are they right?
Well, quantitative easing is a technique you use that when you want to stimulate spending, business investment, consumer investment, and you've gotten interest rates essentially to zero, if you want to bring down the price of assets going out into the future, the interest rate, it's a tool that's been used. It actually helps debtors at the expense of savers. And so in general, if you have a savings account, you're getting very little, whereas as a debtor, you can roll your debts over at low interest. Now, it does tend to make financial assets, all capital assets, houses, stocks, look more valuable relative to the risk-free interest rate. So you do get the stock market going up. It's not done to favor one level of wealth versus another level. It's done for the general economy. Only tax policy can take your level of inequality and be aimed very, in particular at causing some adjustment there.